सुपौल में जाएगी सुरक्षा में आ रही है। श्रमिक स्पेशल ट्रेन जो खगड़िया मानसी के रास्ते सुपौल में जाएगी सुरक्षा में आ रही है।
Hello everyone. Hello everyone. That video was quite disturbing to see. To see that toddler was unaffected by the fact to know that his mother is dead. It would be very painstaking for the toddler to know when he grows up. It will have a very difficult, damaging impact on the mental health of the toddler. While speaking of the mental health, we on behalf of Empower People, we welcome you to another webinar, Psychiatric Impact of COVID-19. With the rise of mental health issues, it is very necessary for all of us to become familiar with this problem and its solution. To share this information, we now have Dr. Cheryl, who is a MD in psychiatry. With around 5 years of experience in mental health, she is a consultant psychiatrist working at Father Muller Medical College, Mangalore. She raises mental health awareness by writing articles and giving talks on mental health issues like depression, suicide, addiction, psychiatry, and dementia. We also have Dr. Jankana Haqqani. She is a consultant psychiatrist in South Mumbai at Safi Hospital, Health Spring, and Mind Health Clinic. With around 9 years of experience, she has come here to share her views about this. She writes blogs and talks about mental health issues to spread awareness. She manages anger management, stress management, relationship issues, behavioral issues in children, depression, and other mood disorders are the topics she covers. So let's dive into the discussion. Over to you, Dr. Cheryl.
Thank you, Bhagyashree. Good evening to everyone who's watching us right now. So for the past few days and a few months, actually, all that we've been hearing about and reading about is COVID-19. And this disease, though it just had its onset somewhere in late 2019, over the past few months, it has become a pandemic engulfing the entire world. And while a lot has been discussed and said about its, physical aspects of the illness, on the health and the economic implications, not much has been talked about what are going to be the psychiatric implications and mental health consequences in the long term. So, but historically, we have seen that, when there are health outbreaks which are so severe and of this magnitude, they are almost always associated with or bound to have adverse mental health consequences. So today, that's what we're going to be doing. We will be discussing about the psychiatric implications of COVID-19. I will initially be talking about what are the possible risk factors and what are going to be the various psychiatric illnesses and disorders that can come up as a consequence or secondary to COVID-19. And later, Dr. Jankana, she'll be talking about how best you can cope and manage in the situation. Now, you must be wondering, like a seemingly, what do you say, a seemingly physical illness only. So far, that's what COVID-19 has been all about. How can it have consequences on the mental health? So, to really understand this better, what we need to do is look at all the effects of COVID-19 so far. I'm sure all of you have been reading about it and hearing about it. So what we've seen so far is acute shortages everywhere, in terms of health infrastructure, in terms of number of treating doctors, nurses. So all of us have a fear. every one of us is scared, what happens if we get the infection, scared that we may not really get the treatment, or if we are able to seek treatment, are we going to get good treatment? So this fear is there in all of us, including me. So that is one thing which has been a main feature of this pandemic. Then the other things added to it are the economic issues associated, like people are losing jobs, there is financial crunch, not able to maintain their households. Along with this, the fear of losing your loved ones. That is a significant fear attached to this pandemic. And then there are other issues, like we have the way we lead our lives so far, that has undergone drastic change in the past few months because of this pandemic. So we have had to limit our movement. We are not able to travel as freely as we want to, or go wherever we want to. And we've had to confine ourselves or contain ourselves within our homes. So all of this, working from home, children are confined to home, economic problems, these are all major stressors. And for some people who are confined to home, there are other issues as well, like domestic violence, sexual abuse. So you can imagine, when we are all faced with so many stressors, the amount of strain that we are under. So definitely, going forwards, there is going to be a mental health crisis. And yeah, people are talking about how best to maintain health. But one thing I'd like to mention is, fear and worry are normal and understandable reactions to any stress in life for any of us. So the fact that when we're faced with stress, all of us get anxious, get worried. But what is happening right now in this pandemic is, the amount of stress we are facing, the magnitude is quite large. So this issue is not just affecting one aspect of our life. It's not affecting only the health. It's affecting the way we lead our lives. It's affecting our financial, economic aspects. So when there's so much at stake, the fear and worry we have can often transcend into something more serious, which is what we will be discussing today: the psychiatric impact of implications of COVID-19. Now that I've mentioned about the psychiatric impact, let us see who is going to be at risk. If I have to really be frank and broadly speaking, each one of us, every one of us who is in this pandemic, who's facing these issues, are at risk. But then again, among us, there are certain people who are more at risk, or whom I would say is more vulnerable. I'm sure all of you would agree with me when I say that, the ones who actually get the infection, who are diagnosed COVID positive, they are the ones who are going to be at a great risk of having some sort of mental health problems. So you can imagine, when you are told, or when you receive the diagnosis that you are COVID positive, what a person must be going through. It can be quite shattering. And he immediately thinks, what is going to happen to him? Is he or she going to make out of this alive? Is he going to survive it? And what if he's infected his family? So you see, these are the thoughts that go through him, and definitely this puts him under great stress and duress. And if one member in a family is affected, the others are not going to be calm. So yes, the parents, the siblings, the spouse, the children of that person, they're also going to be thinking, like, what is going to happen now? So with one person's infection, the whole unit of family is going to be affected. They are all going to be at risk for mental health consequences. So this is one sort of people. The other set of people which I feel are more vulnerable are the elderly, and the ones who already have, medical illnesses, like say diabetes, or who've been diagnosed with cancer, undergoing chemotherapy, or those who already have some sort of immunity compromise like HIV. So these people, as such, already are having a little bit of compromise of their health. They're not in the best of their health. So in this sort of a situation, what is happening is, they are going to be worried, because the way things are going and the current circumstances, they may not be able to go to their regular doctor for checkup. It's difficult to travel. They may not have constant access to healthcare, to medications. This is a very worrying factor for them, because if that doesn't happen, then their illness goes out of hand. So imagine a person who's supposed to receive chemo is not able to do so in these circumstances, or an HIV patient cannot get medication. Definitely, it's going to have a great toll or impact on their mental health. And another thing I'd like to mention is that right now, COVID is at the front of everyone's mind. There's focus on it. But other illnesses are not going to stop even in the pandemic. people are still going to be affected by, diabetes, by cancer, by HIV, by all the other illnesses that we've had so far. So uh, as a result of the measures taken to contain the pandemic, people are going to suffer from these other illnesses as well, and that can cause a lot of mental duress. Okay. And then the next set of people I'd like to highlight is the ones who already have a mental illness. So these are patients who might have been, diagnosed years ago with some sort of mental psychiatric disorder like schizophrenia or bipolar, who might have been doing well all these years with medication, but now right now it becomes difficult for them to go to their psychiatrist or to get medications because of the circumstances. So here, both the patient and the caregiver, I'm sure, if to the people who are listening, if you have a person with a psychiatric illness at home, I am pretty sure you know how difficult it is to manage them without medications and without regularly going to help. It is going to put a lot of stress both on the patient and the caregiver. So they are again at a greater risk for mental health consequences. And lastly, another group which is really vulnerable is our healthcare workers. The media has highlighted them as frontline heroes, but I think they alone know how much of stress they are under. Day in and day out, they are exposing themselves to the risk of infection, and they have to deal with so many things, exposure, going home to families, the worry that they might expose their family members, infect them, being away from families because of the same reason, shortage of resources, and not really having guidelines of how to manage. This is a new illness to all of us. So the stress that they are facing, and the fact that they are going to lose patients. See, at the end of the day, they are going to see people die around them. That is not an easy fact to digest, even though they are doctors or nurses and they're, kind of prepared to accept death. But when you have so many people dying around you, it is not going to be easy to tolerate and cope with it. So yes, briefly putting, these are the groups of people whom I feel are going to be at extreme risk or a special risk, more vulnerable to have mental health consequences in the wake of this pandemic. But again, like I said before, everyone, each one of us is at risk for mental health consequences because we are all going through these social, economic changes to our lives, which are impacting us all negatively. So now that I've mentioned who is at risk and what are the risk factors, I think I'll get to talking about what are the actual psychiatric implications. So, what are the disorders or symptoms that we can see coming up in the next few months? So, I will begin with some of the milder ones and then progress with the more severe illnesses. So, one of the most common or very mild reaction that we can see is something called an emotional reaction. Now, when I say emotional reaction, it could be to the pandemic itself. So hearing about it or the news, what you hear every day, that itself could be quite stressful to people. Or you can have an emotional reaction to getting the illness or a loved one getting infected, or even to the economic problems, So people could have emotional reactions to all of these. All these that I've mentioned are significant life events. Now, when I say emotional reactions, what am I referring to? Like I said before, whenever there's a stress or a stressful situation, it is normal for all of us to react in our own way to it, to deal with it. But here, what is happening is the reaction will be in excess of the usual or the expected response. Now, how do you judge it? There is no hard and fast rule or scale or some kind of assessment tool to say this is normal, this is not normal. Okay, so the best people to understand it would be, the loved ones. So, for example, in a family, the parents know how their child reacts to a particular stressful situation, or the wife knows how a husband reacts. So if you feel that someone around you is not reacting in the appropriate way, or is having a far more severe reaction to a particular stress or a particular situation, then that is the time you need to be worried. Okay. And these emotional reactions could be anything ranging from a complete denial, like maybe a death has happened, so that person is refusing to accept that no, it's not there, it's not a big deal, it's a denial. So that is when you know there has been a problem. Denying it is not really the appropriate response to it. So then you should think that maybe something is wrong and the person is not able to cope with it, or is not able to accept it, is reacting to it in a wrong way. It could also extend to something like an extreme reaction where they just cut off themselves, don't eat well, don't sleep well. So this whole thing or spectrum of emotional reactions can happen. So this is one of the milder forms of mental problem that we can see. Another thing that I would like to talk about is grief. Like I said, people are going to be losing loved ones in this pandemic, and we are all, how do I say it? All of us are going to face death at some point of time of our loved ones or our neighbors, our friends, people we are close to, and we all grieve. Grief is a very normal human reaction. Whenever we lose something that we are close to, it is not very easy to accept the loss, but most of us over a period of time learn to live with it and move on. Here what can happen is, even though the mortality, the death rate in COVID is said to be 3 to 5%, in India, the population is so vast that 3 to 5% will translate into a large number of people dying. Okay, so many families are going to face this problem of losing their loved ones. So, and the death here is going to be not one you're prepared for. Like in terminal illnesses, we are prepared to lose somebody. But this is a sudden illness. Somebody who was seemingly fine, looking healthy, will suddenly contract the disease and die. So their family members, relatives, friends can find it very difficult to sort of cope with it, accept it, and move on. So if they're not able to do it, and they tend to get preoccupied with the deceased person, and their life gets affected, their daily functioning is affected, they're not able to sleep, then we call something, it's called as complicated grief. Okay, so they might require professional help to get through with it and move on in their life. So this is also one problem that we will be seeing in the coming days. Then moving on, some of the other common complaints that might come up would be chronic fatigue, sleep disturbances like insomnia, frustration because of the different economic problems we're going to face, and irritability, that is feeling angry for very trivial things, and sometimes even without any provocation getting angry. So these are some of the symptoms that might come up, especially in an impaired concentration, especially in children and teenagers and the young youth who might just lose employment or in these sort of situations. Another issue that I would like to draw attention to is substance abuse. Now, all of you must be wondering, I've been saying so much about economic loss, where does the money for substance come? So what we must understand is, when people are faced with so many problems in their life, they often go to substances to sort of escape it, deal with their frustration, get over their irritability. So even though they may not be able to afford, they might go to other things like cheap, illicit alcohol, oral tobacco, and you get something called as street drugs, which are very cheap, but the complications they have on our body are like really, really bad. So substance is not going to just affect the mental health; it's going to affect the physical health. And it's also, as we know, when a person in a family has substance abuse, is using all these things, not just him, the whole family and society as a whole has implications on it. And moving on to the most severe disorders, the two disorders that are set to really rise in prevalence in the coming months in the wake of this pandemic are anxiety and depression. So I think anxiety, most of you know that, you feel really breathless, scared, have palpitations, panic attacks. So it can be an incredibly fearful feeling, a debilitating feeling, sort of. And in this spectrum of disorders, I like to mention about something. I think you would have heard about OCD, obsessive compulsive disorder. So for people who know about OCD, there's one particular kind of obsession called contamination obsession. Now, obsession is nothing but a repeated thought the person gets, and he's not able to control it. So when contamination obsession, what they tend to do is they feel things are dirty, so they try to keep washing their hands repeatedly or cleaning surfaces repeatedly. Now, all these years, what have we psychiatrists and psychotherapists, what we've been trying to do is get them to reduce this. So part of the therapy has been to keep in check the number of times they wash their hands and clean surfaces. But now when you have guidelines to, sort of protect yourself by these measures, it's a dilemma for us as professionals when we're treating them. Where do we draw the line between what is acceptable for, providing safety from COVID, and where does it go and breach the line about, when it is that obsession is taking over. So it is going to be tough for us to manage such patients. And then coming to depression, yes, depression is one mental illness which gets a lot of highlight and attention all the time. And in the view of this pandemic as well, um, you can see a rise. Like, studies have been done in different parts of the world, not in India so far, but from Europe we have studies which have shown that there'll be almost a 10 to 15% rise in the number of people who are going to develop depression in the coming months. So yes, these are some of the major illnesses or psychiatric problems that we are going to face. A quick note on, especially I think if there are parents listening to me who have children who are really young in the teenage and youth, they would know that what has happened is children are now confined inside the house, and they have pretty much, a lot of households have free internet access. That has led to a sort of coming up issue, that is online gaming addiction and pornographic addiction. And there have been reports in India itself from most of the metro cities, Mumbai, Delhi, Bangalore as well, where youth and young kids are getting implicated in these addiction disorders. This is a new problem that psychiatrists will have to be. It's not new relatively, but the prevalence of it is increasing in these past few months. So that is another thing that we will be having to focus on in the coming months. And yes, another thing, not really, what do you say, psychiatric disorder, but what has happened is in this pandemic and the lockdown measures and staying home that has been advised, people, couples, children, parents, everybody stuck at home. That is going to take a toll on relationships. In few places, it might really help in bonding, but for I think most part, people are finding it very hard to live with each other 24 hours inside the house for days on end. And again, reports of this have been reported from different parts of India, where issues are rising between married couples who've been married for ages together, but now the problems are coming up because they are constantly kept with each other for a long time. So yes, going forward, this is another area that psychiatrists and psychologists will be, getting people from for these issues. And yes, so I spoke about depression. Another thing that I want to talk about is self-harm and suicide. Now, I think most of you know what suicide is. It basically refers to killing oneself, harming oneself and thereby dying. Self-harm, maybe not everybody knows. Now, self-harm is when people try to injure themselves. Usually, the intention is not to actually die. Sometimes when they have excessive frustration, irritability, they're not able to tolerate or cope well, they try to slash their wrists or their hands. They use knives, sharp objects, or they bang their head to the wall, pull out hair, use cigarette buttons to scorch themselves. So they injure themselves as a coping mechanism, and it's not a right coping mechanism, is to let out their frustration. So now that we are having an increase, we are going to expect an increase in the levels of frustration in people. These sort of behaviors are also going to be on the rise, and along with this, definitely suicide is also going to be on the a rise in the coming future. So now that I spoke so much about illnesses, what can we as people, common public, and what can all of us do and around us regarding this? So I would suggest that everybody be a little bit more vigilant and sensitive to people around us, to oneself, and definitely people around us. It is key right now because so many people are going to be affected. I think the best thing would be that we sort of keep our eyes open. So what would you actually be looking for? Any kind of deviation or change, drastic change in the way a person behaves that you have seen of late. Okay, so that could be in terms of, like I said before, irritability, excessive frustration, frustrated all the time, mood swings, sleep disturbances, not eating well, the talk what you have, like what they talk about, very bizarre things or odd things, not talking at all, and sometimes saying things like it's better if I die, or what is there to life more. So these sort of things, and excessive using of substances, so, or self-harm tendencies. So if you see all these things in a person around you, your family member, a friend or relative, then definitely I think it warrants, it should ring a bell in your head, and warrants for you to try to get them to psychiatric professional help. It might be there is no harm in getting them evaluated. If there's no problem, well and good, but it's better to always be safe than sorry. And ignoring or not treating mental illnesses can be quite disastrous for not just the person, for the individual as a whole. And for people who already have relatives or family members who are suffering from mental health illnesses, I would suggest that please try as much as possible to keep them keep ensure that they have the medication, they're compliant to their medications, and try to keep the unnecessary information about the pandemic away from it. Limit what they know about the pandemic. Unnecessarily stressing them, worrying them is not going to make matters better. The pandemic is going to take its own course, and they are already vulnerable, so exposing them to every possible news item is not really required. And before I finish, something about suicide. What we must remember is suicide is not just always a consequence of mental health illness. It is a social and economic problem as well. So not everybody who commits suicide has a psychiatric disorder, something I think we should all understand. So right now in this pandemic, there are social factors, economic factors, and mental health factors at play. So if we are anticipating a rise in the number of suicides, personally, if I have to say from the place I come from, there have been so many news reports in the past 2 months of people who have ended their lives. For what? Because of the fear of getting COVID. Without even knowing, without even being tested, they're so fearful of getting the illness that they have killed themselves. And many of them have tested negative later. So you see, it's not just mental health, mental illness, which makes somebody attempt suicide. Other factors are at play. One is here importantly in this pandemic, the fear of getting the illness, the financial economic losses, relationship issues, domestic violence, sexual abuse, and substance use. So these are also some of the other factors at play. So yeah, that is about what I had to say about the risk factors and the different psychiatric problems we're going to see. Dr. Jankana, I think, will be talking about how best you can manage and cope in this situation.
So, thank you so much, Dr. Sharil, for sharing this information about dividing, like categorizing different kinds of people and their issues. You talked about denial, you talked about grief, substance abuse. Each thing matters, the information matters a lot, and you touched upon a very sensitive topic of suicide. So, I uh, I've seen due to this lockdown, people are engaged in their own thoughts because there is nothing to do. So the thoughts of the past is coming back to them. So it's very difficult for them to handle it on their own, and moreover, it is very difficult for them to approach someone because there is limitation, there is thinking limitation in their thinking, that what if I approach a mental health worker, what will people think of me? They have these limitations still going on in their mind. So but we, in order to help them, we are all built with some coping mechanisms. So it would be great if a person knows these coping mechanisms. So over to you, Dr. Jankana.
Thank you, Dr. Bhagashree, and thank you, Dr. Sharil, for giving us this amazing insight over the problems that we face during COVID. Now, we all know that we are in COVID. We are suffering from anxiety, fear. Now, because of lockdown, social distancing, anxiety, fear, what to do, uncertainties, it is a natural human response. Any threat a human faces, any whether it is perceived or real, COVID being a very real threat. Not that everybody will get COVID, but it is a threat. So it is a stress to us. So what happens? Normally we get stressed, we get fearful, which is a good thing actually. This will help us become alert and aware and help us take precautions as to what are we supposed to do so that we don't get COVID, or how do we stay away from people. So because of this, the government has laid down issues for social distancing and lockdown as a precaution so that the COVID spread reduces. But many times this stress increases, or anxiety increases, or fear increases. And if it increases to such an extent that you are not able to cope with day to day activities, it is interfering with your day to day routine, you are not able to focus on anything, then it becomes a problem. You enter burnout. Now, normally in day to day life, we have stress. Everybody has stress, financial stress, job stress, school stress, exam stress, but we tend to cope. But it becomes difficult in a pandemic like COVID, where you know that it may be life threatening. And COVID is something, it is a virus which is not, you are not able to see it. So it is a stress. So when you have a burnout, there are many illnesses which can follow because of increased stress, which Dr. Sharrell has already said. To name a few, I can say fear, anxiety, panic, loneliness, depression, irritability, and sleep problems are few of them. So how do we cope with these? But before coping, we have one positive thing with us. Everybody has this, that is resilience. What is resilience? It is the ability of our brain to bounce back from the trauma or the threat or the stress. Now, resilience is different in different individuals. Like physical resilience is different for everybody, same way mental health resilience is different. This resilience helps us improve. How fast we improve depends on this mental resilience. So, to increase your physical resilience, what do? We do exercise, we eat healthy. Same way, we can improve our mental resilience as well. How do we do that? For that, I will be talking about 6 coping strategies. The first one is, first and foremost, everything around us is out of control. The pandemic is out of control. So when humans find themselves in a situation where everything is out of control, they become very stressed. They become worried. They develop anxious. They are afraid of uncertainties. They don't know what is going to happen. So what you do is you first find a sense of control. How will you find a sense of control? By controlling what is under your control, like your routine, your schedules. Have a schedule. Wake up at a particular time, do your core household chores, do your work, and maintain a schedule. Set apart certain time for exercise as well. Stick to specific schedules. Second coping strategy is make goals. Because right now we mostly are at home, working from home. We don't know what to do, when to do, how to do. So much information is coming from all over. Should I do this? Should I do that? I don't know. So limit yourself and make goals. And these goals have to be time specific. Like suppose you choose that, okay, I want to finish this, my office has given me this work, I have to finish this work, finish in 7 days. So you have to try and finish it in 7 days. It has to be time specific, and every day I will put 2 to 3 hours behind this work. So when you accomplish a goal, this gives you a sense of improved self esteem. This gives you a sense of motivation to do better, and it lowers your anxiety, and you feel that, yes, I can do more. Things are in my control. The third coping mechanism will be self care. Uh, like physically, we take care of ourselves, we have baths, we will do yoga, we will do gym, we will dance, to release endorphins. Same way, mentally, you need to take care of yourself. How will you do that? For many people, calming down, many people calm down in different ways. So for you, what suits you is individually different. So for somebody, maybe breathing exercises calms them down. Maybe meditation for 15-20 minutes will calm them down. Somebody may put on very loud hard rock music and it will calm them down. For many people, very soft music will calm them down. So these are the things you can do. The other thing which you can do is positive self talk. Like, suppose if you are demotivated, talk to yourself that it is okay, you can do this. See how much you have achieved till now. And you have made some mistakes. You did not calculate COVID in your calculations. Okay, COVID will happen, so this is how I'm going to go about. It happened. You have to accept that. But it is not your fault that the mistakes have happened. So don't be so harsh on yourself. Forgive yourself and accept that it is okay, and what can I do about it to improve my situation. It was a mistake. Nobody could have seen this COVID happening. Be grateful that, okay, today I have a house, I'm safe at my house, I have food, I have electricity, I can connect with people. Be grateful about what you have. This will make you positive. Help others around you. You know, in your building, wherever you live, there are many old people who cannot go out. Help them. Arrange fruits or vegetables for the whole building. You know, when some people are selling wholesale, they sell only few dozens they will send. They will not send 1 dozen. So, you know, little things, helping others or technologically also helping others will give you that satisfaction that you are being useful. Also, keep yourself busy by organizing your closets or learning new hobbies, new skills which will add to your resume, which will improve your resume. What you can keep yourself busy in entertainment, Netflix, Woot, Amazon Prime, etc. But again, this entertainment has to be limited. The last thing I would say for self care is mindfulness. Whenever you are feeling frightened, whenever you're feeling very anxious, be mindful about your surroundings. You can remember the rule of three. Okay, three things I can see around me. Like, it could be a curtain, the fan, the light, my door, my mother, my father, my daughter. Three things I can see. Three things I can hear: the sound of the fan, the sound of the bird chirping outside, the sound of the car passing by, or the sound of a blender. And three things that you can feel: your pillow, your bed sheet. So this will distract your mind and refocus on other things, and be mindful about your surroundings. This will help to calm your mind. So these are the self-care things. Now, the fourth thing is to combat the most common problem right now everybody is facing is loneliness and boredom. What to do about these two things? Because you are used to this fast paced life. You are used to getting up in the morning, get ready, go to work, and after work, go meet your friends, go for a party, go for a get together, have 4, 5 meetings, come back home, go to, and then have more work. But suddenly, all this has stopped. Your life has come to a standstill. You are bored. You don't know what to do. Suddenly there is silence. You don't know where to go. You are not allowed to go out. You are not even it's better that you don't go to your friend's house or your neighbor's house because it's not safe. So what do? Think of the people who matter most to you, who are most important to you, who are the people who will be supportive of you, and the people who will not put you down if you share some things with them. So they are generally only 4 or 5 number of people. It could be your parents, your children, your spouses, or one or two good friends. Acquaintances are there, but then that is just for work. These are the important people in your life. So I would say that deliberately try to connect with them if you're already not connecting. Use this time to improve your relationships with them. I would say not only connect with them, but reconnect with them. You can use technology for this. It's so easy now. WhatsApp video calling, Skype is available, FaceTime, etc. is available, Zoom meetings. You all can even, you all can sit down if somebody of your relatives are not in town, they are far away. You all can have a meal together. You all can play games together. So this way you reconnect, and this way you can ward off loneliness by having this social contact with others. Also, many of us have been forced to work from home. Working from home is like you're still working alone. So, what do? You reach out to a colleague, you reach out to your supervisor, ask them to be your buddy system. So, when you are working out and if you're stuck or if they are stuck, you are available. Reach out to them via video calling or audio calling, because it is always better. It gives more social touch than a text or an email. But many times, this feeling of loneliness, boredom, sadness just does not go away. So, and it is a sign of a medical disorder called depression. Depression is a medical disorder. Always take help from your psychiatrist. It is a treatable disorder. Medicines are available. It is a treatable problem, and medicines are safe and not addicting. So you must approach a psychiatrist if you have depression disorder. Now, the fifth uh, coping strategy is how to combat anxiety. Now, again, after loneliness and boredom, anxiety is also one of the very common problems which we are facing. It could be panic disorder, it could be OCD, it could be um, generalized anxiety disorder, or it could be an anxiety about contracting the disease. What will happen to me? What will happen to me? So, first and foremost, learn what is COVID from genuine sites, genuine news channels. What is COVID? What is this coronavirus? How much is it deadly? How fatal it is? Not every person who gets corona will die. Many of them are recovering. Treatment is available and people are working on it. So again, so this solves your issue about what will the fear of contracting COVID. But what about other anxieties that still keep lingering on back of my mind the whole day? I know the fact that everybody is not going to die, but what do I do? It just does, my mind doesn't shut off. So for that, first thing is control your information flow. Watch very limited news. Don't keep watching news throughout the day. First, watch only the genuine news channel. Don't follow whatever forwards you get on WhatsApp. Follow only local news. You don't need to know what is going on in the US. You don't even need to know what is going on outside your city. And if that news is not pertaining to you, you don't need to watch it. Suppose I am a student and the news about migrants is not pertaining to me, I will not watch it. Let's shut off that. Or you can just limit your time for 15 to 20 minutes of news watching every day. That should be more than enough. Second thing is, people are anxious about uncertainty. What if? What if this happens? Nothing is certain. But in life, nothing has ever been certain. If you go about even before COVID, can you think about the time when you were 100% certain that this is going to happen? Some small thing as nice as getting up in the morning and going to the office. Are you 100% certain you are going to get a cab? Are you going to get a rickshaw or a bus? What if you don't get? What if you don't reach on time? Again, that is not 100% certainty. So we are anyways living or were living in world of uncertainty. So once you accept that uncertainty is a part of life, it becomes a little better. You tend to calm yourself down, because even before COVID, accidents used to happen, natural disasters used to happen. So this helps calm themselves down. But even after telling ourselves, it is not like our mind is a switch off button. Okay, switch off. Okay, the worry has gone, the anxiety has gone. What will you do? So set aside a worry period. Train yourself. It will not come in one day. It will take time, but it will come. So set aside a worry period. In the afternoon, 2 to 2:30. This is my worry period. I will worry only during this time. So when I worry, but during the whole day, I'm getting these thoughts. What do? Write on a piece of paper. keep that paper with you and only worry during that time. Till then, you can refocus again by using mindful strategies, by using goals and other strategies which I've mentioned earlier. So, and then every day reduce this worry time by 5 minutes. And sometimes it may happen that in your worry period you are sitting, but you are not worried at all. What do? Arey, I'm not able to get, my anxiety is gone. It's not coming. What do I do? It's okay. The period is over. We'll do it tomorrow. If it comes, okay. If it doesn't come, then next day. Okay. But all this works for mild anxiety. What will you do if you're in? How will you know that, okay, this is the time now I have to approach somebody? I need help. How will you come to know? When your anxiety interferes your day-to-day activities, you are not able to focus, or you're having a severe panic attack which just does not go away, or repeated panic attacks. You're having hyperventilation, increased heart rate, in a sense of impending doom, or it is so debilitating it stays the whole day. Then you must see your psychiatrist. You must see or your doctor, and you must get treatment for your anxiety disorder. Again, anxiety disorders are medical condition. It is a medical disorder. The medications are available. It is treatable. Medications are safe and they are non-addicting. Now, the sixth and most important thing is people, because of worries or whatever other issues, financial issues, economic losses, family loss, grief, whatever the reason, or maybe no reason at all, they are not getting enough sleep. There is difficulty in sleep. So, how will you cope with that? You have to follow sleep hygiene. What is sleep hygiene? First, avoid nap traps. Don't fall into the nap traps. I'm bored. I have nothing to do. ठीक है घर से ही काम करना है. Let me go off to sleep. We'll see. No napping in the afternoon. If you nap in the afternoon, you will not have the urge to sleep at night. The more delay you make your sleep because of whatever reason, the screen time, worries, etc., instead of the 24 hours sleep which we have, the cycle, it will extend to 27 hours. And when that happens, you will not be able to sleep. Okay. And the next thing is no looking at the clock again and again. रात को अरे 2 बज गए, I cannot sleep. अरे 3 बज गए, I cannot sleep. No looking at the clock when you're sleeping. Decrease your caffeine drinks, decrease coffee, decrease tea, reduce cold drinks. Cold drinks also have caffeine. Reduce energy drinks. Smoking, please do not do. There are other options available. Consult your psychiatrist for that, or any other doctor or a medical worker. They will help you. Warm water bath before bed helps to sleep. They say warm milk with a little bit of turmeric will help you to sleep. One more thing I would like to say is keep looking outside the window. Keep looking at the sky all the time. All you have to do is just turn your neck to left or right towards the window, and you can see the window and you can see the sky. Keep doing that. So your mind is aware, okay, it is morning, it is evening, it is night, you are oriented. So when you're oriented, the brain will circulate melatonin. Melatonin is something which helps you sleep. It maintains your sleep-wake cycle. And last thing is use the bed only for sleep, nothing else. So if you're on the bed, you are not getting sleep for 30 minutes, get up again, go to the hall, read a very boring book, come back to sleep. Do this 2 or 3 times in the night and you will be able to sleep. But so this way you can help yourself sleep better. But many times, if we cannot sleep, many times sleep is the first sign of an underlying issue. There has to be some issue. There never is only sleep difficulty for months together only cause or the only problem. It is a symptom of a bigger psychiatric issue. It could be depression, it could be familial issues, relationship issues, financial issues, whatever it is causing you stress and not causing sleep. So please consult your doctor and have a, a proper mental health checkup done to find out what is actually the issue. The last thing I would like to say, that for this monitoring your sleep and anxiety, there are various apps available online. One of a very good app I know is called CBT I Coach. I say it again, it is CBT I Coach. It is made for the veterans for the US Army, but it is available for free for everybody to download and use it. It will help you. But if it go, like I said, if it goes beyond that, you are so debilitating, you are not able to control your behavior, or you're not able to control your anxiety, please consult a psychiatrist. Okay, so we are done with the coping strategies, but I would like to add a little bit about children. What about children during this pandemic? Children are at home. They are not allowed to go outside. They are frustrated. They are angry. They're missing their school. They want to be in the school. They want to meet their friends. They want to go to the beach. Uh, they want. They don't have that physical activity in urban cities. It is not a luxury to have a big house, to have a front yard, to have a backyard where the children will play. They are very small homes. So how do we help them cope? First and foremost, talk to your children. When you are speaking with them, please look at them and talk to them. Not looking at your phone or doing something else. Look at them, speak with them. Not at them, but with them. Ask them what they are feeling. If they are too small where they cannot convey their feeling, ask them to draw their feelings. They do draw and they do tell us. Uh, they have concerns. They are also confused. What is going on? What is to happen? Clear their doubts. Explain them what is corona, what is expected, and clear all their doubts, and be very transparent with them. Do not lie to them because they come to know. And tell them whatever they understand at their age level. Teach them about social distancing. Teach them about hygiene. Teach them about washing hands, and teach them about coughing in the elbow and not on the hand. So they learn pretty fast. And one more thing in sleep hygiene, I forgot, the wake up time has to be the same. Even for kids, wake them up at 8 a.m. Everybody has to wake up at 8 a.m. If they are not used to napping in the afternoon, do not make them nap. Then also children, they do well with routine. So develop a set of routine with them. School work from this time to this time. Physical activity. There are a lot of YouTube videos available where you can teach children dancing or any other thing that they like. They can do doodling, they can do Zentangles, coloring. Lot of creativity and lot of online classes are also available, and many of them are free. Many of them are on YouTube. Lot of DIYs are on YouTube. Involve kids in household activities. Ask them to help you in cooking. Ask them to help you in cleaning, mopping, etc. So thank you. This was about a little bit about coping strategies.
Okay, thank you, Dr. Jankana, for sharing those coping strategies. It was really useful to know all these coping strategies. And when you said, also, I would like to draw attention to the point that the sleep problem is not only because of one thing. There are many things attached to it. And as Dr. Cheryl said, denial is something which when not dealt with it correctly can affect us really badly. So yeah, so we also have few questions by the audience.
Yes, please.
It's Shivani Nirmal who says, good point on gaming addiction. Might COVID also increase cases of cyberbullying? I would like Dr. Cheryl to address this question.
Yeah, that is an important aspect that we'll have to look into. So far, there has been no evidence as such, or no reports. All the reports that we have received from different parts of India, especially I'm talking about, it's majorly about the increase or the rise in gaming addiction. Cyberbullying is existent, but particularly in relation to COVID, there has been no association seen so far. So as of now, there is no extra risk of cyberbullying because on view of this pandemic. But definitely, the rise is going to be there in the number of people who are going to be involved in gaming addiction. That definitely is there.
Okay, thank you, Dr. Cheryl. Shweta asked how to support or help who confess they have suicidal thoughts. It's really difficult when we often tend to give reactions, oh God, like this. So I think Dr. Jankana can address this issue.
Okay, so when you have a friend or a relative or an acquaintance even or a colleague who says, okay, look, I want to commit suicide, or anything that, I have finished everything, I have given away everything, my whole life is over, there's nothing worth living, and they say, I want to commit suicide. So what first thing you do is you just tell them, okay. You do not tell them, okay, this is your problem, you will get over it, and uh, don't tell them that. They don't want your advice. They want, whenever a patient says, I want to commit suicide, they want to be heard. So just be there, listen to them. Tell them, okay, okay, I know, I understand. And then they will talk further. Ask them to talk about it. Keep a hold on them. Do not let them go, because this is when they are committing suicide. And to commit suicide, there is a when they get support in that crisis, they will not commit suicide. So just listen to them and ask them that, are you taking some medicines? Are you seeing a doctor? Do you need me to help you with that? Ask them. And I'm here for you. I understand everything. Do not give them advice. Just say, okay, you are correct. I'm here for you. And do you need help that I can help you with calling your doctor or booking an appointment with your doctor or calling a psychiatrist and listen to what they have to say rather than telling them कि, okay, you did this, it's not such big a problem, मेरे में तो ये problem है. Do not compare, do not give them advice. They don't want advice. They just want to be heard and be available to them. It may take 10 to 30 minutes for them to calm down. All you have to do is say, okay, I am there, I am listening, I understand, and it will help them uh, avoid that attempt. And in the future, see to it that they do take help from somebody.
Yes, Dr. Zankana rightly pointed out, and it has a normal human tendency. It's to give advices over such topic. Whatever happens, we give advices and we internalize, like put ourselves into the picture and compare it. So that's really good point. We have another question by Nikunj who says to suggest for people who are scared sitting at home, listening other cases, getting positive in nearby vicinity. People are absolutely paranoid. That's true, Nikunj. I really appreciate that question. And yes, Dr. Cheryl, would you like to answer that question?
Yes, so people are getting worried that around them in their vicinity there are positive cases coming up, and it is quite fairly normal to feel like that. But I think Dr. Jankana mentioned, and what I would like to repeat is that we need to really understand that how the illness spreads. So refer to the correct information that the WHO and the state and national health departments have put out about how the virus transmits and how you can protect yourself. So Yes, there are cases around you. You cannot prevent that. They have gotten infected. There was no role for you to play there. You cannot do much about it. But what is in your hands is to how can you best avoid getting infected yourself. So practice those measures, social distancing measures. Keep distance while you are, maybe if you have to go to a grocery shop in the neighborhood. You know there are cases in the neighborhood, so maintain your distance. The minute you come back, wash your hands. Or if you're you can use gloves while purchasing grocery, and if use a mask. So these are the measures that has been the guidelines put forth by the government and the health ministry. So follow these measures, because every area there are going to be cases very soon. The illness is spreading. So being paranoid is not going to help us sort of deal with it, or uh, get across it. So we will have to correctly understand how the virus spreads and what measures we can take, which is within our control, to sort of halt the transmission. So wash your hands, use masks, use sanitizers, use gloves wherever you can, keep safe distance. So these are things that are within our control, what we can do. Worrying about it is not going to halt the progression. That is something I would like to reiterate. Yes, we are worried, but being paranoid and worrying about it is not going to help matters in any way.
That's really true. And I would like to add one more thing is that when we hear a case in our vicinity, we tend to overlook on that person and, question them or tend to put them aside. You have got COVID and we get scared. What if we get because of you? So it's better to be more helpful and compassionate to those people. So, our next question is, what are your thoughts on the stigmatization of COVID-19 patients?
Yeah,
So,
that is. Sorry, Jankana wants to address it.
Okay, okay. Okay, first thing is, yes, people, because people are scared, they say, oh my God, COVID-19. Oh my God, he's suffering from COVID-19. What a bad person he is. But that is not true. He is not COVID-19. He is suffering from COVID-19. He is suffering from an infection which he has got, which is an airborne infection. So the stigmatizing them, like even many doctors have been stigmatized. They have many buildings have shut down that because you are working in a COVID hospital, you will not come inside the building. Now this is not correct. So it is not supposed. It is not something that you are supposed to stigmatize. People are getting infected with no fault of theirs. It is just a threat that is causing the stigmatization. Because COVID is still unknown to us, it is causing stigmatization. But many people who do get COVID also, they are asymptomatic. So unless somebody tells you कि इसको COVID है, you will not even come to know many times. And Dr. Sharal, would you like to add something on this?
Yeah, so see, stigma, a lot of diseases have, had stigma attached to them. Mental health disorders per se have a lot of stigma attached to them. So now, when it comes to COVID, it's mainly because it's so easily transmitted that people are keeping a distance or avoiding. But blaming the person, isolating the person is not going to help us, proceed any further in trying to overcome this illness or combat it. So we will have to accept that somebody has that illness. There is treatment available for the illness. He or she will take treatment for it. Right now the government is very strict, so whoever tests positive is being treated. So all we can do is, if it's a loved one or near, someone dear to you, your friend, you will have to be there for them, because try to understand how they also feel. It is a very, like I said before, it's quite shattering to know that you have tested positive. So in that context, if we try to isolate them and stigmatize them, it is not going to help anyone. It is going to adversely affect their mental health anyway. So it is going to lead to like a vicious cycle of sorts. The people who are stigmatized will go into a shell. They will not come out. Their family is isolated. It doesn't spell well for us as society as a whole. The only way that we can probably combat and move ahead is if everybody is aware of the illness. Everybody knows that it's just an illness and it is not something, to be isolated away from. In the sense, social isolation, yes, for preventing the illness, but you don't have to like stop talking to them, or you can always keep in touch on the phone, inquire about their well-being, so that you are supporting them while they are fighting the illness. Stigmatization is not going to help us achieve anything. But yes, it is there. So you cannot say that it's not there. It definitely is there. A lot of people are bearing the brunt of this in India as well. There have been reports in places where entire family has been isolated. They're not allowed to buy groceries from an area because somebody in the house has tested positive. So we need to really put ourselves in the place of that person or that family who's going through the crisis to understand what they're feeling.
So, rightly said, we have to be more empathetic to that person and put ourselves into their shoes and think how would they feel about it. Our next question is by Rohit, who says, "How does one cope and plan with the uncertainty of when it would be safe to resume some of the activities that we considered routine and mundane in the pre-COVID-19 era?" Can Dr. Jankana address
Yes,
this question? Yeah.
sure. Uh, Now, this uh, COVID is here to stay. We need to accept that. And with accepting that, we need to know what are the measures we are going to take. This is going to last for a very long time. And the way which we are living right now, like social distancing, wearing masks, washing hands, uh, doing a lot of work online, this is going to be our way of life for at least a year, if not more. So we have to accept it, and uh, and the way we are living, it will continue like this for a long period of time. And this uncertainty is going to remain. Like I said, everything in life is not 100% certain. Everything, even without COVID, things were not 100% certain. You didn't know that you are going to get dinner at 8 p.m. You didn't know you're gonna have time for a morning tea before you leave for work. So same way, this is uncertain, and it is, you have to accept it is in an infection which you will get probably, which you may not get probably, and even if you get, it may be a mild type, because by the time everything starts moving, the lockdown is over, and we would have developed herd immunity. Indians are good with immunity against infectious diseases, so we may, fight better than other countries right now, which we are seeing. So we may cope better, but yeah, we have to accept that this is how it is going to be.
So to deal with the uncertainty is to just accept the fact that let things remain unplanned or unknown. It's okay to not know things how they'll work out.
You anyways
So
never knew things, right?
yes, yes. So do we have next question? Yes, and it's by Savina. She wants to question Dr. Cheryl. Her question is, how do we deal with frequent stress-induced migraine during these times? Dr. Cheryl, over to you.
Yes, so it's an interesting question. What we need to know is migraine is it's a neurological disorder, and there are a number of factors that trigger migraines. So in different patients, there are different triggers for it. Now, stress can also be a trigger factor. So the way to stop the migraine would be to control the stress. Since it's a stress-induced migraine attack, the only ways are to cut down on the stress. Now, for these, you can like Dr. Jankana has already spoken about the different measures. So, in this situation where we are faced with so many new realities and problems and stressful situations, uh, so using those coping strategies that she has already mentioned, like there are so many things out of our control, but to try to keep in control what we can, like maintaining a regular routine, and so you have a schedule, you stick to it, so some sort of planning for your day, and then including exercise, which is a good stress buster. So physical exercise, keeping a good diet. And since right now most of us are working from home, we lose track of time doing things, so there's no schedule as such, so try to avoid that. Maintain your daily routine, have some sort of exercise, it is a good stress buster, eat a good diet. and try to avoid unnecessary exposure to news items. Like I said before, there's a lot of news being spoken about COVID. Not all of it is authentic, not all of it is true. A lot of it can rattle us easily, can cause you to feel very bad and very this thing. So only you trust sources which are authentic, which are accurate, which give you the right information you need to know for your safety. So try to limit that. Don't try to engage in a lot of news reading or going through many channels which say the same things again and again. Number of deaths here today is 100, there it is 500. No, it's not going to help you. We know this illness is going to spread, but it's not going to really help you in the long run. So try to live your day as normally as you can prior to the pandemic. Do all these activities, do your daily work. If you're working from home, keep a keep a schedule for how many hours you're going to work and how many hours you're going to indulge in other activities, in creative activities or your household work, etc. And yes, if the stress becomes really intolerable, like if you're somebody who has really low threshold, then you will require to take help, because if the stress is causing migraine attacks, maybe it is quite serious, so you are not able to tolerate it, your threshold may be low. In that case, please do try to contact a psychologist or a psychiatrist, take help. And I think one thing we've not mentioned is there are teleconsultation services for those who are able to get access to them. Do try to use these services so that you can keep your stress in check. That is the only way to reduce stress induced migraine attacks. We have to reduce the stress levels first. And yes, keep your migraine requires long term treatment, so please keep taking those medications regularly.
So, yeah, that's completely true. Self care, as Dr. Zankana pointed out, is really important during this time. Um, our next question is by Nitin, who says he has seen people experiences working stress, that is, excessive working more than regular working lifestyle. Is this going to be the new norm? How do you advise both employers and employees to know when to stop what?
Okay.
Okay, so can Dr. Jankana look into this?
Yeah, about this, there is something called as workplace mental health. In this, both employees and employers have to agree upon the dedicated time to work. Many times it is given that you will work from 9 to 5 or 10 to 4, but sometimes people, those who are working, they tend to work beyond the given time. So it is the duty of the employee uh, to tell their employer that, okay, now this is my personal time. I will help you with this tomorrow, and my working hours are over. You need to learn to say no with this. You have to divide time. Sometimes when it is an emergency or it is some urgent matter, 1 or 2 hours extra twice so a week is okay. But when this happens a routine, then you need to tell that, okay, and you need to switch off your work phone. You need to switch off your work email, and not be available. Because if you keep answering, then people will take you for granted. Okay, he is answering my phone even at 12 in the night, so let me call him. He will do the work because he is the one who's been doing that. So you have to say no to it, and you have to set time limits.
Yes, Dr. Jankana, learning to say no and prioritizing ourselves when we are completely caught up with the work is the right advice. So, before we conclude, I would like to ask Dr. Cheryl if she has anything else or any message to say to our viewers.
Yeah, so before concluding, all I'd like to say is yes, I've spoken a lot about the risk factors, who is at risk, what are the illnesses. It is not to scare anybody, but to understand that mental health issues is going to be a real possibility and a problem that we are really going to face. So it is better to create awareness, start talking about it now itself, rather than later be left in the lurch kind of thing. So don't be worried, and do whatever you can to keep your mental health good. So the practices that mean keeping a schedule for yourself, and practicing mindfulness, good diet, good exercise, and if you already have a mental illness, take your medications regularly. Make sure to consult a psychiatrist or psychotherapist regularly, and be vigilant and be sensitive to people around you. People with mental illness cannot be blamed for having mental illness. We need to understand that. So you have to have empathy towards them. Try to understand that. How they feel. It's very difficult to imagine what a person with mental illness feels. It's really, really difficult. So blaming them or ridiculing them or isolating them is not the way to do it. So we need to really be there for them, empathize with them, be on the lookout for any possible warning signs in people around us. So I think the whole agenda of creating awareness is that, so that when people around you might be succumbing, or they might be developing symptoms, so you can get them timely help. So till then, stay happy, stay healthy.
Thank you, Dr. Cheryl, reaching out and self-care and for all these advices. Now, Dr. Jankana, I would like you to speak about something.
What I would like to end with is help is available. Everybody is ready to help you. All you have to do is ask for it. Now, with this COVID, I will say it is a silver lining in a dark cloud that people are available online with a click of a WhatsApp button. Just click, and your doctors are also available for you. The psychiatrists are available for you for teleconsultation, and other doctors also are available. There are many apps available. So, utilize it all and stay safe and stay healthy.
Thank you,
Thank you
Dr.
for
Jankana.
attending.
Thank you, Dr. Jankana. Thank you, Dr. Cheryl. And thank you all the viewers for joining this webinar. Thank you.